When we talk about preparedness, I guess the first thing to do is to remember the lessons learned of what happened. Do you remember, or perhaps have you forgotten? I think the world in many ways is trying to forget what has happened in the past 5 years, but we absolutely shouldn't. And for those who have actually forgotten, a little reminder. On the 31st of December 2019, WHO's country office in the People's Republic of China picked up a media statement by the Wuhan Municipal Health Commission from their website on cases of viral pneumonia in Wuhan. So this is COVID-19, 31st of December. It could have waited one day and it would have been COVID 2020, which would be more appropriate considering all that happened in 2020. Anyway, the rest is history. The 1st of January, WHO activated the incident management team. On the 5th of January, WHO issued the first EIS and DON, the Bulletins for Epidemic Intelligence, the disease outbreak news, to communicate to the world about this event. On the 9th, between the 9th and the 12th of January, WHO had already started issuing the first packages of technical guidance. And on the 13th of January, the first PCR protocol was published. And a public health emergency of international concern was declared on the 30th of January. And on the 4th of February, the Strategic Preparedness and Response Plan was issued. So all this in a little more than 1 month at the very start. And I think when we speak about COVID-19 in Italy, we have to remember this picture. I mean, for me, it's a picture I'll never forget. You know, when on the 19th of March, seeing all the deceased patients being transported out of Bergamo, this is when everybody who was looking, the whole world was looking and said, this is very serious. I mean, we already knew, but this was really, really a big wake-up call. So, and when we talk about preparedness, we also have to remember that this was not the first time a new pathogen originated, of course. And we had SARS, we had avian flu, we have, and we currently still do. We have MERS, and we currently still do. We have Zika, we have the Ebola in West Africa, and so on and so forth. So it is also thanks to that, and especially with regards to MERS-CoV, that WHO was able to gather very quick lessons learned from the coronavirus, epidemiology, to produce the first technical guidance in a little more than a couple of weeks. Having said that, there's a lot of things that we will do differently, but I think that it is more appropriate to say what we are doing differently, because pandemic preparedness is not, next time we will do something better. It is at the moment, right now, what are we doing differently? I think the Mood project is a perfect example of what currently has happened and currently is still happening, and I hope that of course, the Mood will continue in some sort of capacity as well as it was just said. And learning from the from the devastating effect of the COVID-19 and other emergencies, to continue doing better. In terms of health, we had more than 20 million estimated deaths. We had $16 trillion of estimated revenue losses in the international sectors. We had 1.6 billion students out of school. We had 30% less investment in clean energy transition. So this affected also the climate in that way. And we have more than 135 million people pushed into poverty by 2030. And all this, you can see the references. This is only data that is related to the effects of the COVID pandemic. On top of that, we have other emergencies. I mean, large-scale epidemics are increasing in frequency and impact. And in addition, we have more than 300 million people in need of humanitarian assistance as a result of climate disasters and geopolitical crisis. So we're talking preparedness, or we're talking reaction, or we're talking about being ready and being successful in protecting the world from health emergencies. So how does your work contribute? As we just said, this is not a project, is not a nice prevention plan. It's actually all the work that we're all doing as public health experts to prepare and be more effective for the next pandemic. WHO is learning the lessons from COVID-19 to strengthen what we call, it's a bit of a mouthful, but health emergency prevention, preparedness, response, and resilience. It's the HEPR. And this framework has been developed based on independent reviews of synthesizing 300 post-COVID recommendations, and has equity, inclusivity, and coherence at its center, with strong governance, leadership, regulation, accountability, capacity, coordination, collaboration, and strong systems, and of course, financing. Without resources, we will not be able to do anything. So finance, health coordination, preparedness financing, response financing. And as part of this framework, in terms of governance, the member states, because when we say WHO is learning, it's the member states, it's all of us here, it's all of you driving a stronger future. There's been a revision of the international health regulations. There is the pandemic treaty in development and in negotiation. In terms of financing, there are national investment plans to support better preparedness, financing for sustainable preparedness, the pandemic source and other resources to reinforce surveillance, lab, the workforce. And in terms of systems, as I was saying, the HEPR framework that has been published, trying to bring all this together. And how does it bring it together? Well, it's centered on 5 C's: emergency coordination, collaborative surveillance, community protection, access to countermeasures, safe and scalable care. And according to the 6 functions of WHO, which are leadership on matters critical to health, shape the research agenda, set norms and standards, and of course also monitor their implementation, articulate an evidence-based policy, articulate ethical and evidence-based policy options, provide technical support, and monitor the health situation and assess the health trends. And all this is inscribed in the WHO 14th General Program of Work for 2025 and 2028, the GPW 14, which objective is to promote, provide, and protect health and well-being for all people everywhere. And I want to especially emphasize the protect part, because here is where we all are working and what we will discuss today in these 2 days. Prevent, mitigate, and prepare for risk to health hazard from all hazards. Rapidly detect and sustain effective response to all health emergencies. So what will we do better? Well, it is a matter of acting fast, and it's not acting fast in 1 month when, like I showed at the beginning. Ideally, the action fast should happen at the moment, because timely action is critical to contain and minimize impact. use the experience and preparation and leverage lessons learned to build robust systems and ensure readiness. Keep always science as the foundation. Evidence-based decision-making must drive responses. But of course, it's only one part of the equation. I think that's the one we're most comfortable with, at least personally, as an epidemiologist. And the evidence-based decision. But we know that trust and leadership is probably the more complicated one. When I started as a naive epidemiologist, I was always saying, epidemiology is no rocket science, it's just about showing evidence-based, and everybody will get on board to follow the recommendations. Well, we've seen with the COVID-19 pandemic and the current trends, geopolitical trends, that this is easier said than done. So it is probably more complicated than rocket science. Actually, it is way more complicated than rocket science, despite what a certain billionaire who's sending electric cars to space wants to maintain. And so trust and leadership is really key for me and for all of us. Without it, even all the best plans will fail. And sustain the momentum. And I know it's hard 5 years on, but to leverage progress, calibrate strategies, and ensure systems are maintained and sustainable. And again, emphasizing that pandemic preparedness is now. The groundwork for a stronger global health system starts but doesn't end with the response. And in terms of response, of course, the lessons learned. Responding to COVID-19 is preparing for the next one. So strengthen global research capacity for future pandemic, enhance surveillance, testing capacity, sequencing, public health intelligence, equitable access to medical countermeasures, develop trust by engaging communities, build and scale resistant healthcare systems, and invest in long-term pandemic preparedness. And we already talked about it, engaging society way beyond, already talked about it this morning, way beyond the health system. The health system is only one piece of the puzzle. We have animal health, culture, we have the economic finance, we have social welfare and protection, we have disaster management and national security, we have the environment. All of it with great partnership, and we can only do it with strengthening these even more. And the mood is just providing this perfect example of what we're talking about. So what we do, what we should be doing, or what are we doing, is national and subnational core capabilities, reinforcing at that level, but also keeping in mind the global and regional technical and operational support models. With who? With partnerships and networks at all levels, national, regional, and global, clearly defining the roles and the responsibilities and the ways of working. And how? With tools and technologies. We already heard about some of the tools and technologies developed through the MOOD project. The resource requirements and the financing flows to put these tools and technologies in place. The learning and capacity development needs. The research and innovation. And of course, measuring the impact of what we do. And all this is grounded in resilient communities and in primary healthcare. I think we all agree that all health emergencies begin and end in the community, and especially when it comes to infectious diseases. There's always a patient zero. Patient zero that then can transmit the disease to a local outbreak, national outbreak, regional, global outbreak, and then a pandemic. So this requires resilient communities and primary healthcare systems, supported by national, regional, and global networks for prevention, preparedness, readiness, and response. And talking about the science, it is translating all the evidence we have into knowledge and actions, translating the technical knowledge into coordinated action using robust and appropriate methods. Again, what we already heard this morning, the Mood project clearly exemplifies all this. And talking about the beyond health or beyond human health component of our work, are we taking concrete steps to prevent zoonotic emergence and spillovers and amplification? We know that an estimated of 70–80% of emerging infectious diseases are zoonotic. Addressing drivers involves all of us then, and changes at the human-animal-environment interface increase the spillover risk. We have deforestation, biodiversity loss, climate change, we have pollution, we have the animal marketing practices and trade, we have intensive farming, agriculture, urbanization, migration, and global mobility, and I could go on for many more examples. And the key here is to anticipate the risk for earlier detection, not just surveillance in the human populations, but have stronger surveillance and laboratory systems that are holistic, that can map the spillover of pathogens with epidemic and pandemic potential. And again, going back to lessons learned, we all have the desire to forget somehow the COVID-19 pandemics, and but this hasn't really gone away. So the response of today is also the preparedness. COVID-19 response continues because SARS-CoV-2 continues to circulate and evolves without a predictable seasonal pattern. Despite 5 years, or let's say almost 5 years, a virus, this virus is still with many unknowns and continues to create burden on health systems with acute and long-term health effects. Recovery has been strong but uneven globally. Dismantling of systems is very real, because despite the fact that COVID-19 catalyzed some progress in preparedness and demonstrated the value of integrated approaches, I guess we all know that, at least in my circle of friends, before people didn't know exactly what my job was. As soon as the pandemic hit, everybody was asking me and calling me, you are an epidemiologist, we value your opinion, we want to know. So this momentum was really demonstrated, and I'm sure this is common for all of you. However, the systems really remain in many places still inadequate or weakened. We also have other pathogens that are circulating with pandemic potential, the avian influenza. Since 2020, we have seen consistently the emergence of H5 clades, with more species, including wild birds and terrestrial and marine mammals, having infected with H5 viruses. So there's a true risk there. We have also many other concurrent outbreaks. This is just a few. The Mpox, the global cholera. Talking about a bacteria, I think it's the only bacterial example here. Cholera is also a pandemic, and it's a pandemic that has been raging since '69. The Marburg, currently happening in Rwanda, Zika, Oropouche, chikungunya, dengue. and the MERS who's still there. So leveraging all these capacities is possible and should be done. And just as an example, the laboratory capacities that have dramatically expanded during the COVID-19 pandemic. Another example, for example, PCR. Nobody knew what PCR was. And then everybody was discussing if to travel to see grandma, they should do a PCR or a rapid test, and everybody became an expert on that. And so we could leverage this expanded capacity. Clinical care, of course, the lessons learned of the first medical interventions for the COVID pandemic were a very dramatic moment, but over time we learned. We have strengthened the systems, including the national capacity for oxygen, for example, IPC, research capacity, risk communication and community engagement, etc. And harnessing our collective expertise as experts. WHO coordinates many advisory groups. I'm sure that some of you or many of you will probably be part of these groups. And this list here is far from comprehensive, but we have the STAG-IH, the SAGO, the TAG for arbovirus, and we have several task forces, for example, the cholera task force, the meningitis task force, all of them working to define guidelines and to support their implementation. And we're working on as I mentioned already, the amendments to the International Health Regulation. This is a huge piece of work that the member states have tasked us with. It was adopted at the 77th World Health Assembly with some key new elements: establishment of a national EHR authority, the determination and definition of a pandemic emergency, the commitment to solidarity and equity, the use of digital health documents. I think when we work on surveillance, this is has huge potential to be a game changer if we have electronic records. And the establishment of a states party committee for the implementation of the IHR. I went back. We have the intergovernmental negotiating body, the INB, which is now working with all the member states on the pandemic treaty. Officially, the mandate is to draft and negotiate a WHO convention, agreement, or other international instrument on pandemic preparedness, prevention, preparedness, and response, with a view to adoption under Article 19. But this is the pandemic treaty. I ran out of time. Which we hope will be adopted at the WHA 78 in May 2025. And reaching towards the end, a word that is on the alert in the sense of, prepared and ready to respond is the world where we can prevent, ideally, most pandemics, prepare for large-scale outbreaks, and detect and response in case we cannot prevent, using science, trust, transparency, and collaboration. And protecting global health in this holistic way means tackling all hazards together through collaboration and innovation. It's not just about COVID or respiratory viruses, but we need to work collectively to work on pandemic threats and biosecurity, high-threat epidemics, cholera, meningitis, yellow fever, humanitarian crisis and disasters, systemic threats and unfinished agenda. For example, was already mentioned AMR this morning, to reduce the impact that these events have on health, social, and the economy. And at WHO, we are, as you probably know, we're often restructuring, but at the moment, we're also trying to see how we can have a more unified approach internally in WHO to epidemic and pandemic threat management, with a unified vision to have all epidemic and pandemic threats, including arbovirus, viral hemorrhagic fevers, mpox, respiratory threats, cholera, and so on, brought together under one strategic umbrella. This is the department that Maria currently heads to, with the vision to addressing all the interconnected nature of global health threats, and foster better coordination and collaboration, promoting cross-program collaboration within WHO and with its external partners, leveraging multidisciplinary expertise to tackle health threats holistically, and eventually have an improved preparedness and response, a stronger integration of surveillance, laboratory diagnostics, data analytics, and response capacities, and a streamlined pathway for decision-making and prioritization of resources. And this vision is, from what we already heard this morning, is the shared vision between WHO and the MOOD project, strengthening preparedness using data-driven tools, enhancing surveillance in One Health, modeling efforts, laboratory systems, developing the workforce and capacity building, with immediate practical applications for the improved detection of zoonotic spillover, the climate data integration, the enhanced public health response, and the development of tailored interventions by integrating environmental and health data. And strengthen cross-border collaboration, in this case, especially since the MOOD project, as was shown by Elena, is in Europe, within Europe, but for WHO it is for the whole world. So I'm looking forward to being with you the next 2 days and hearing about how this shared vision can be achieved, and participate to the discussions and the interesting program. Thank you very much.